So members of a major Minnesota nurses union have said they favor going on strike if negotiations don't resolve differences with management of several health systems in the Twin Cities and Duluth. So there are around 15,000 members of the Minnesota Nurses Association that cast ballots on Mondays whether to authorize a strike. With the union announcing late Monday night that its members voted overwhelmingly in favor, the vote sets up another phase in negotiations that go back to last March, according to the union. The disagreements appear to be over staffing levels, working conditions, and paid family leave. So hospital executives with $1 million salaries have created a crisis of retention and care in our healthcare system. This is coming from the president of the Minnesota Nurses Association, Mary Turner. She said, as more nurses are leaving the bedside, putting quality patient care at risk, nurses do not take this decision lightly, but we are determined to take a stand at the bargaining table and on the sidewalk if necessary to put patients before profits in our hospitals. So this is a huge undertaking by the nurses. This is not just people at work striking about their own working conditions, about their wages, about the resources they have at work or long hours. These are nurses saying we've got to change the way we do things because we're not taking care of people, and that's what we want our job to be. That's why we became nurses. Not so different from what we were just talking about in this last story about the people in Congress who are workers in Congress putting pressure on their bosses to actually use their work and their resources to do things that they agree with more so that they have more say about what's going on in their workplace. But this strike vote covers nurses working at 15 hospitals under 7 hospital systems. We've got a list of those hospitals that you can look at above. You can see for these CEOs compensations. These CEOs are making a ton of money. $3.5 million, $2.69 million, $2.4 million, and to the right, a pay ratio to the average registered nurse. At the first hospital, 40-1, the second 2 hospitals, 38-1, and at Methodist, 28-1. So a huge pay differential. A comparison of some of the hospitals included in the Minnesota Nurses Association press release. So nurses are saying that hospitals are dangerously understaffed, leading to more patient injuries like bed sores and falls. Turner, the president of the union, pointed out a recent report from the Minnesota Department of Health that shows adverse health effects were up 33% in 2021 from 2020. Last year, nurses filed 8,000 reports of unsafe staffing levels, an increase of 300% from 2014. Nurses filed the reports when they fear low staffing levels could lead to patient injuries, which also jeopardize nurses' licenses if they're found to be at fault. So they're striking for very good reasons beyond their own self-interest. They care a lot about these patients, and it sucks that it's the workers that are paid far less than the CEOs that are taking on this burden of saving patients' lives and saving people whose care should be under the owners of the hospitals. This is a consequence of having a profit-driven healthcare system, and thank God these nurses are standing up. We all stand to benefit from this. JR, what are your thoughts?
It's tough, man. It's one of those occupations where it's hard to take that time to then get the right representation, or at least get the right kind of working conditions when things are unfair like this. Because of course there's potential people who then pay the consequences, which is why it's such a big deal if they do, because it has to happen. Something has to move here, because are we just gonna openly not care about some of these patients? But the problem is it already seems that's a big issue, which leads to something like this. Where do you turn? And also, how many people would look and go, how dare these nurses turn their backs on their patients? I remember during COVID, during 2020, I believe it was up in Maine, there was a group of nurses that were looking to strike or walk away from their patients because they were against the vaccines, or at least the type of masking and care that they're supposed to go and approach this type of thing. And I think that failed to a degree because they were talking about it, they were rallying it, but they didn't end up doing it. And people were against that move. So to what degree, I wonder, people are going, oh, nurses make just enough, they're fine. Oh yes, that's a CEO. He's supposed to make $3.69 million every year while nurses are in certain conditions and maybe don't get the fair amount there, or at least have a situation where there's enough people there. And again, it goes right back on them again as far as who's accused or who's at fault when something does happen, because of something that's outside of their control. And I know these strikes have happened. We talked about it earlier just now, when you want people to organize at work. And this is the scary part. Once you organize, you may get a voice, you're gonna hear what's happening, but they're gonna come at you hard, man. And then we wonder, someone says, I'm not gonna go to the hospital and deal with these nurses. Now look at they're turning on us. No, they're trying to actually give you a better situation where you can have some care. But it takes multiple deep talk to talk about this, which sadly a lot of these folks in power know people don't have time to talk about.
Yeah, and it's one thing to point out all of this and say, look at what's going on, but all it takes is one trip to the hospital for people to realize that this is going on everywhere. This is not a problem unique to Minnesota. And when you think about the problem of these hospitals being understaffed, and you look at the pay ratio, okay, 40-1, $3.5 million for the CEO. If the problem is that you're understaffed, let's put the CEO at a nurse's salary, or even the pay of 2 nurses, right? Now we have 38 new nurses and we still have the CEO. Seems like a fine solution to me. I don't know, the numbers really speak for themselves there. The problem solved. Yeah, this is really an example of something that is a trend in our country right now. So this strike vote is a part of a trend of workers striking around the country, from Starbucks workers to strippers in Los Angeles. But it's also a trend among nurses across the country. In Michigan, roughly 6,200 Michigan medicine nurses are determined to carry out a struggle against the university hospital system for safe staffing levels, higher wages, benefits, and workplace safety. In California, 2,000 Kaiser permanent mental health therapists are set to go on their first indefinite strike ever starting on Monday. The contracts for tens of thousands of Kaiser nurses and other healthcare workers have expired or are about to. And in Buffalo, New York, the Communications Workers of America and the Service Employees International Union Local 1199 have called a one-day informational picket at 2 hospitals on Tuesday. The unions have kept 7,000 nurses on their job through contract extensions and other stalling. So this is happening across the country, and it's really important to point out that yes, workers walking off their job might inconvenience you. You might say, well, what happens if I have an emergency and I need to go to the hospital and the workers are striking? But in the long run, everyone really stands to benefit. We have data from the Department of Health and Human Services that prior to last year, the uninsured rate had consistently remained in the double digits for decades. The number of uninsured Americans began dropping after the ACA, which expanded Medicaid and offers health insurance to people who lack job-based coverage through a mix of subsidized private plans. And this was enacted in 2010. Roughly 26 million people remain without health insurance in the United States. That's the latest numbers from Health and Human Services. And right now we're still facing multiple pandemics, polio, COVID, and monkeypox. We really need strong healthcare systems right now. COVID cases, the daily average right now is still around 100,000 cases. We're still experiencing 415 deaths per day, 5,837 new admissions to hospitals for COVID. Polio also is back. It's terrifying, terrifying. The New York City Health Department and the New York State Department of Health have identified poliovirus in sewage, and this suggests local transmission of the virus. They test the sewage to see the prevalence of the virus in the area, and they found it in the sewage there. Let's also just quickly take a look at this map about monkeypox. There are 12,689 total confirmed cases of monkeypox throughout the country, concentrated in those darker areas on that map. So it's good that the nurses are striking right now, because it's looking like we're going to need to rely on our healthcare system in the United States more intensely, and it needs to be better equipped to serve the people in this country. Jayar, any last thoughts on this?
Yeah, this is my last thought on this. At some point, think about this wild scenario where CEOs can get paid this much, these millions of dollars, and the basis for their success in a company is not necessarily how much it brings back into themselves and the shareholders, but maybe the retention of good employees, maybe the happiness of employees. That should be the gauge, and it shouldn't seem like a crazy thing that, hey, this particular CEO is the best in the country. Look at how happy his employees are. Look at how much they want to stay. Look at how much money they make. Because it should be attractive to want to work for someone, because then if you have better workers for you, you would think your business does better. And at the end of it all, you then do make more money.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.